The silence around this topic in standard medical consultations is deafening, yet the implications for your health are anything but quiet. Let me state this with the clarity that decades of clinical practice demand. If you've abandoned self-pleasure in your later years, your body is likely undergoing a cascade of detrimental physiological changes right now, and you're probably completely unaware of the silent erosion occurring within. This isn't about indulging in taboo or locker room bravado. This is the unvarnished, scientifically grounded reality of how your body functions and what it requires to maintain vitality as you age. The cost of disregarding this fundamental biological need extends far beyond the realm of sexual function. It infiltrates your cognitive sharpness, cardiovascular resilience, restorative sleep patterns, immune defenses, and the very core of your self-perception and worth. I am Dr. Lucy Stone. With over 30 years dedicated to urology and men's health, I've traversed the country working intimately with aging patients, witnessing firsthand the complex interplay between time, physiology, and personal well-being. My career has been a deep dive into the intricate ways the human body transforms with age, particularly focusing on intimacy, hormonal landscapes, and the preservation of long-term vitality. One of the most pervasive and under-discussed threats I've consistently encountered is this: a significant number of older adults, often subtly encouraged by societal whispers or personal misconceptions, consciously or unconsciously relinquish their sexual health. In doing so, they inadvertently surrender a cornerstone of their overall physiological and psychological equilibrium, a pillar crucial for navigating the later chapters of life with resilience and dignity. What many find genuinely startling is the profound misconception that masturbation is merely a vestigial impulse from youth, a relic to be outgrown. The reality, grounded in robust physiological understanding, is starkly different. It represents one of the most potent, readily available tools your aging body possesses for regulating critical hormones, fortifying neural pathways, actively protecting prostate health, and generating natural defenses against the encroaching shadows of depression and anxiety. If this practice has faded from your life, or perhaps never truly found its place, the silent toll extracted from your holistic health, physical, mental, and emotional, is likely far steeper than you could possibly imagine. The absence of this simple act triggers a series of interconnected biological events with wide-ranging consequences. In the following exploration, I will meticulously guide you through the specific, often hidden, internal processes set in motion when self-stimulation ceases in older age. What I reveal may fundamentally reshape your understanding of your own health and your relationship with your aging self. Before we embark on this crucial journey, if preserving your cognitive acuity, physical robustness, and cherished independence as you age resonates with you, I urge you to take a moment to subscribe and activate notifications. Ensuring you receive this vital, personalized health advice is paramount. Furthermore, if this message strikes a chord, acknowledging it with a 1 in the comments provides invaluable feedback, a 0 if it doesn't. Your input directly shapes the support I offer. Now, let's confront the first, and perhaps most chronically overlooked, consequence of abandoning masturbation in later life: its insidious impact on your prostate and the fundamental mechanics of urination. The degradation of prostate health and urinary function represents a critical, often silent, fallout. When I first stepped into my urology practice over 3 decades ago, I didn't anticipate the sheer volume of patients who would hesitantly confide in me about such a deeply private, yet vitally important, aspect of their well-being: the quiet disappearance of their sexual routines as they entered their later years. One gentleman remains vividly etched in my memory. Sitting across from me, a man in his early 70s, outwardly fit and mentally sharp, confessed with a resigned shrug, "Doc, I just figured that part of life wasn't needed anymore." His primary complaint: waking 4 or 5 times nightly, plagued by an urgent need to urinate, a disruptive pattern he couldn't comprehend. What eluded him, and what escapes the awareness of most men, is the indispensable role regular ejaculation, achieved even through self-stimulation, plays in maintaining optimal prostate function. The prostate is far from a passive bystander. It's a dynamic, living organ. It diligently produces seminal fluid, expands, contracts, and demands engagement. Like any intricate system, neglect leads to dysfunction. Without consistent stimulation and the subsequent release, prostatic fluid stagnates. This stagnation creates an ideal breeding ground for inflammation, swelling, and ultimately, the kind of unrelenting pressure that disrupts everything from the simple, essential act of urination to sexual capability itself. You might experience this as a persistently heavy feeling in your bladder, a frustratingly weak urinary stream, or an uncomfortable, lingering sense of pelvic fullness. These aren't mere inconveniences. They are early distress signals from your body. The peril lies in how chronic prostate congestion can insidiously escalate into more severe conditions like benign prostatic hyperplasia, BPH, a condition affecting nearly half of all men over 60. Left unaddressed, BPH can lead to urinary retention, recurrent bladder infections, and in severe cases, necessitate catheterization or even surgery. Precisely the outcome for the gentleman I mentioned earlier. A surgical intervention became unavoidable to relieve the pressure, a scenario potentially preventable had simple, consistent habits like regular ejaculation been maintained earlier. This natural process acts as an internal flush, clearing out accumulated fluids, reducing inflammation, and significantly lowering the risk of harmful buildup. Compelling research underscores this, showing men who ejaculate approximately 21 times or more per month exhibit a notably reduced risk of developing prostate cancer compared to those who abstain. Crucially, this isn't a call to recapture youth or engage in obsessive behavior. It transcends fantasy. This is fundamentally about physiological function. It's about leveraging your inherent biology to safeguard your body in the most straightforward, natural manner conceivable. When you cease masturbation in older age, you're not merely foregoing pleasure. You're actively courting pain, chronic inflammation, and a gradual erosion of control over one of life's most basic functions, urination. I've witnessed patients become virtual prisoners in their own homes, paralyzed by the fear of not reaching a bathroom in time. I've seen strong, self-assured men reduced to shadows of themselves, consumed by sleepless nights and daytime anxiety, wrestling with a condition potentially manageable, or even preventable, through something as accessible as regular self-stimulation. The psychological toll is equally devastating. Losing dominion over your body in this intimate way, the constant planning around bathroom access, the dread of travel, the relentless nightly interruptions, systematically erodes your sense of autonomy. It's not solely about the prostate gland. It's about the profound loss of personal freedom and independence that defines a life well lived. The insidious nature of this neglect is that its effects radiate far beyond the pelvic region. The subsequent consequence penetrates the very core of your being, your brain. Once initiated, this cognitive shift can fundamentally alter how you think, process emotions, form memories, and perceive the world, often in ways that become entrenched and challenging to reverse. We must now confront what happens to your mental clarity and cognitive faculties when self-stimulation vanishes from your routine. If this resonates, affirming your engagement with a 1 in the comments is deeply appreciated. Now, let's delve into the second critical point, cognitive fog and the insidious decline of mental sharpness. I recall a patient, a man in his late 60s, arriving for a consultation. His primary concern wasn't physical energy or prostate issues. It was a profound, unsettling statement. "Doc, I don't feel like myself anymore. I walk into rooms and instantly forget my purpose. My thoughts evaporate mid-sentence. I used to possess such sharpness. Is this just age?" This lament echoes through my practice far more frequently than most would suspect. While aging naturally introduces some cognitive shifts, what remains largely unknown, even among highly educated and health-conscious individuals, is the potent role sexual activity, including masturbation, plays in actively safeguarding brain function. The biological mechanism is clear and powerful. Engaging in self-pleasure triggers a significant neurochemical cascade within your brain. Dopamine, serotonin, oxytocin, and endorphins flood your system, neurotransmitters intrinsically linked to memory consolidation, focused attention, learning capacity, and emotional stability. These chemicals do far more than generate momentary pleasure. They are fundamental building blocks for neuroplasticity, fostering the creation and maintenance of synaptic connections. They enhance cerebral blood flow, delivering vital oxygen and nutrients. Simultaneously, they actively suppress cortisol, the notorious stress hormone that, when chronically elevated, inflicts tangible damage on brain cells, particularly in regions governing memory like the hippocampus. When self-stimulation ceases, especially over extended periods, these vital, protective neurochemical surges become infrequent or absent. Over time, this deprivation manifests as a dulling of your mental edge. You may struggle with concentration, find information processing laborious, or experience a pervasive lack of motivation. This decline isn't abrupt, it's a slow, stealthy creep. Initially, it might be forgetting names, then losing track of dates, eventually leading to a profound doubt in your own cognitive abilities. Within this doubt, a more pernicious element can take root: fear. I've observed patients spiral into debilitating anxiety and depression, convinced they were experiencing irreversible dementia, when in truth, their brains were starved of essential stimulation and the chemical equilibrium that regular self-intimacy helps sustain. For men, this is compounded by a critical hormonal shift. Testosterone, intrinsically tied not only to libido but also to memory retention, decisiveness, assertiveness, and overall vitality, often experiences a more rapid decline when sexual activity dwindles. Crucially, frequent, healthy ejaculation contributes to the regulation and preservation of testosterone levels as you age. Emerging research is beginning to establish links between reduced sexual activity in older adults and earlier onset of measurable cognitive decline, even pointing towards increased vulnerability to conditions like dementia. While I am not asserting that ceasing masturbation directly causes Alzheimer's, the evidence strongly suggests that when the brain is chronically deprived of the specific form of stimulation, emotional release, and hormonal support, its resilience falters. It loses its rhythmic balance, becoming more susceptible to deterioration. For many, the thickening fog becomes dense enough to alter their entire existence, how they engage socially, process information, and fundamentally perceive themselves. One patient confessed he abandoned his cherished chess club because he could no longer sustain focus during games. Another, a retired professor, described waking each morning feeling unervingly blank. These weren't necessarily cases requiring pharmacological intervention for dementia. They were often symptoms of a life disconnected from physical intimacy, even the intimate connection with oneself. The profound tragedy lies in the avoidable nature of this suffering. The solution doesn't always demand expensive pharmaceuticals or complex therapies. Sometimes, the path to clarity begins with a simple, courageous act of reconnecting with your own body, granting it the attention it silently, physiologically craves. Stimulating the body effectively awakens and nourishes the brain. However, this erosion of mental acuity is merely one facet of a larger, more complex picture. The subsequent consequence, where emotional equilibrium begins to subtly unravel and mood starts its unpredictable descent, can be even more insidious, profoundly damaging, and infinitely harder to articulate. We now explore how relinquishing self-intimacy can silently open the door for depression to permeate your daily existence. Heightened depression and emotional numbness represent a deeply personal and often hidden cost. I recall a patient, a widower in his early 70s, ostensibly healthy and retired. He came to me not for a physical ailment, but for an indescribable inner void. Looking directly at me, he stated, "I don't feel anything anymore. Not sadness, not joy. Just flat." After a heavy pause, he added the haunting question, "Is that just normal for someone my age?" That query resonates because variations of it are voiced in my office constantly. What many dismiss as an inevitable facet of aging, the pervasive dullness, the sense of detachment, the gradual fading of emotional color, frequently possesses a deeper, physiological root cause, one shrouded in societal discomfort: the cessation of sexual stimulation, particularly the intimate act of self-pleasure. The biological truth is this: when you cease engaging with your own body in a physically intimate way, your emotional landscape undergoes a quiet but profound metamorphosis. Masturbation transcends mere physical mechanics. It is a potent emotional release valve. It constitutes your body's innate, built-in stress relief mechanism. During orgasm, the brain discharges a powerful cocktail of neurochemicals: oxytocin, the bonding hormone, endorphins, natural opioids, and serotonin, all acting as natural mood stabilizers and potent combatants against anxiety, tension, and the creeping tendrils of low mood. When you excise this release from your life, particularly during periods inherently laden with stress, loneliness, or grief, common companions in later life, you risk descending into emotional numbness. This numbness can be a treacherous gateway to clinical depression. I've witnessed this progression unfold with heartbreaking predictability. An individual stops masturbating, perhaps after losing a partner, or driven by the belief that it's inappropriate at their age. Weeks blur into months. They become increasingly withdrawn, quieter. Hobbies lose their allure. Conversations feel burdensome. Sleep patterns fracture, too much or too little. Appetite fluctuates. The world begins to lose its vibrancy, fading into shades of gray. The cruelest irony is that most fail to recognize the connection. They internalize blame, attributing it to personal weakness, or resign themselves to the belief that this bleakness is simply the definition of growing old. In reality, what they are profoundly missing is the essential act of connecting with their own physicality. Not solely for hedonistic pleasure, but for fundamental emotional survival. Depression in older adults is notoriously underdiagnosed because it rarely presents as overt sadness. Instead, it often manifests as profound fatigue, unexplained irritability, emotional detachment, or the complete absence of motivation and desire, a pervasive apathy. While medications and therapy are vital components of treatment, I cannot overstate how many patients I've witnessed experience remarkable shifts simply by reclaiming physical self-intimacy. One man described feeling alive again after consciously beginning to touch himself regularly for the first time in years. He emphasized it wasn't merely an elevation in mood, it was a visceral reminder that he remained a sentient, feeling human being, not merely a biological entity in gradual decline. That simple, private act restored a piece of his identity he believed was irrevocably lost. This is the core understanding I implore you to grasp. Masturbation in later life is not fundamentally about fantasy, lust, or shame. It is a critical practice for maintaining emotional homeostasis. It provides your body a physiological pathway to feel, to release pent-up tension, to remember what it means to be fully present in your own existence. When you sever that connection, you risk far more than transient sadness. You court profound isolation, emotional atrophy, and in severe cases, a perilous erosion of the will to actively engage with life itself. Yet, the emotional repercussions are merely one thread in a complex tapestry of decline. As nights stretch into agonizing periods of wakefulness and sleep becomes increasingly fragmented, another hidden cost emerges, one with far-reaching implications for memory consolidation, immune defense, and vulnerability to chronic disease. We now examine how the absence of sexual release might be systematically stealing the deep, restorative sleep your aging body desperately requires for repair and rejuvenation. Poorer sleep quality is a pervasive and debilitating consequence. I remember a man in his late 60s consulting me after enduring months of exhausting sleep deprivation. He appeared visibly worn, pallid, and deeply frustrated. "Doc," he confided, "I fall asleep okay, but I jolt awake at 2 a.m. like I've been electrocuted. Then I just lie there, staring at the ceiling, counting the hours until dawn." Comprehensive testing revealed no clear culprits. Blood work was unremarkable. Sleep apnea was ruled out. However, when I gently broached the subject of his intimate life, he averted his gaze, murmuring, "That part of me, it's over." Unbeknownst to him, the aspect he considered expired was potentially the very key his body was silently screaming for: deep, uninterrupted, restorative sleep. Sleep is not passive oblivion. It's an exquisitely orchestrated hormonal ballet. One of nature's most potent, yet often forgotten, triggers for initiating deep, restorative sleep stages is orgasm. During climax, your body releases a powerful, soporific cocktail: oxytocin, promoting calm, prolactin, inducing relaxation and satiety, and endorphins, reducing pain and inducing euphoria. This combination is biologically designed to rapidly shift the nervous system out of the high-alert, fight-or-flight state, sympathetic dominance, into the restorative, rest and digest, mode, parasympathetic dominance. Simultaneously, cortisol levels, the primary hormone responsible for anxiety and wakefulness, plummet sharply. Your breathing deepens and slows, your heart rate steadies, muscle tension dissolves. You transition seamlessly into the ideal physiological state for entering deep, slow-wave, sleep and REM sleep. The stage is crucial for physical repair, memory consolidation, and emotional processing. Now, consider removing this potent, natural sleep induction mechanism entirely from your life, not temporarily, but consistently over weeks, months, or years. This is the stark reality for many older adults who cease masturbating. The body loses one of its most reliable, innate tools for achieving profound rest. What often fills this void? Restlessness, mental churning, physical tossing and turning, and pervasive frustration. Some resort to sleeping pills, masking the symptom without addressing the root cause. Others simply resign themselves to chronic exhaustion as an unavoidable hallmark of aging. However, the ramifications of persistent poor sleep extend far beyond daytime fatigue. Chronic sleep deprivation is a systemic assault. It cripples immune function, accelerating the body's vulnerability to infections. It directly accelerates cognitive decline and neuronal damage. It significantly elevates the risk of hypertension, heart attack, and stroke. And it exacerbates underlying anxiety and depression, creating a vicious cycle. For older adults specifically, it contributes to increased fall risk, profound memory lapses, and a tangible loss of independence. I've observed patients who were once vibrantly active gradually withdraw from social engagements and hobbies, not due to a diagnosed major illness, but simply because the unrelenting exhaustion rendered basic functioning overwhelming. The alarming disconnect is that many remain oblivious to the absence of the very thing that once reliably facilitated their sleep, not a prescription, not a supplement, but their own body's innate physiological release valve. Masturbation might appear insignificant, even trivial, but for countless individuals, it can demarcate the difference between 4 hours of fractured, shallow sleep and 7 hours of deep, healing rest. One patient, after cautiously reintroducing this practice, reported back, "I sleep like I did decades ago. I genuinely hadn't realized how much my body needed that release. I just assumed my broken sleep was an inevitable price of getting older." This encapsulates the core tragedy. Too many individuals misattribute the consequences of biological neglect to the natural aging process itself, suffering needlessly in silence. If you find yourself lying awake night after night, mind racing, body tense, watching the agonizingly slow passage of time, pause and ask yourself, when was the last time your body experienced complete, utter relaxation and release? Often, the solution isn't found in a new prescription or meditation app. It lies in rediscovering an ancient, intrinsic rhythm that your physiology still recognizes and deeply craves, if only permitted to express it. While sleep deprivation insidiously undermines energy and mental clarity, the next consequence manifests even more tangibly in your physical form. It reveals itself in weakening muscles, shifting balance, and the distressing betrayal of bladder control. We must now examine what truly occurs within your pelvic floor and circulatory system when intimate self-connection is abandoned. Weakened pelvic floor musculature and compromised blood circulation constitute a direct physical toll. Several years ago, I treated a retired firefighter in his 70s, a man who had epitomized physical strength throughout his life. He presented with complaints of mild urinary leakage and discomfort in his lower back and hips when standing for extended periods. "It's unsettling," he admitted. "I feel like the very foundation of my body is slowly crumbling." His description pinpointed the gradual, often imperceptible, weakening of his pelvic floor, the complex web of muscles forming the base of his core, providing essential support for his bladder, bowel, and sexual organs. He was far from alone. Most individuals remain blissfully unaware of these muscles until dysfunction manifests as urinary incontinence, constipation, erectile difficulties, or pain during movement. The crucial, frequently ignored fact is this: regular sexual stimulation, including masturbation, serves as a vital workout for maintaining the tone, strength, and responsiveness of these pelvic floor muscles. During arousal and orgasm, the pelvic floor contracts rhythmically and powerfully. These contractions are not about performance aesthetics, they are functional exercise. They significantly enhance blood flow to the pelvic region and genitals, strengthen the internal support structures critical for continence and organ positioning, and maintain effective communication between nerves and muscles. It's fundamentally about physiological preservation. When regular masturbation ceases, these muscles don't merely rest, they begin to atrophy due to disuse. Blood circulation to the area diminishes. Tissues lose elasticity. Nerve sensitivity and responsiveness wane. Gradually, symptoms emerge that were previously unthinkable. Sudden, urgent needs to urinate, slight dribbling post-voiding, difficulty controlling gas, or discomfort during simple activities like walking or standing. For men, this often translates to a marked decline in erectile function and sensation. For women, it can lead to vaginal dryness, increased tension, and pain that discourages any form of intimacy, further compounding the problem. I've witnessed confident individuals begin avoiding social gatherings, travel, or even long walks, solely due to a lack of trust in their bladder control. Others endure profound embarrassment from unexpected leaks when coughing, laughing, or sneezing, unaware that this often traces back to years of neglecting the circulation and muscular activity in their pelvic region. The critical point is this: ignoring pelvic floor health is not merely inconvenient, it poses tangible risks, including increased susceptibility to falls, progressive incontinence, and an erosion of personal dignity that no one should have to endure. Reliance on protective pads, specialized undergarments, or constant bathroom mapping becomes a daily reality, all stemming from a foundational area of the body deprived of essential stimulation and support. The longer this neglect persists, the more challenging rehabilitation becomes. What is truly heartbreaking is the silent suffering endured by so many. Shame, confusion, or the mistaken belief that this is an unavoidable aspect of aging prevents open discussion and proactive management. I cannot emphasize this sufficiently. Your body, even at 70, 80, or beyond, possesses an inherent drive to function optimally. One of the most effective, natural, non-pharmacological ways to support pelvic floor health is through safe, regular, intimate self-stimulation. Reclaiming this connection isn't solely about accessing pleasure, it's an act of physical restoration. It actively pumps oxygen-rich blood into neglected tissues, reawakens dormant nerves, maintains tissue vitality, and sends a powerful message to your lower body: you are still essential, still valued, still very much alive. While this consequence is intensely physical, the next penetrates even deeper, reaching into your immune defenses, cellular repair mechanisms, and your body's innate capacity to shield you from illness. The internal biochemical aftermath of orgasm harbors one of the most crucial, yet consistently overlooked, health advantages for the aging body. We now confront how sexual inactivity might be quietly crippling your immune resilience. Diminished immune function is a stealthy, systemic consequence. A few winters ago, a long-term patient, a man in his late 60s with a history of robust health, arrived looking visibly depleted. He'd suffered through 3 separate bouts of illness that season, lingering colds and low-grade infections that sapped his energy for weeks. "I used to bounce back overnight," he lamented. "Now, the slightest bug floors me for what feels like forever." After meticulously ruling out dietary deficiencies, sleep disorders, and medication side effects, I gently inquired about another dimension of his life. "Have you maintained any sexual activity, even privately?" He offered an uncomfortable smile before shaking his head. "Nah, not for a long time. That part of me is just retired." What eluded him, and what remains poorly understood, is the direct, quantifiable impact sexual activity, including masturbation, exerts on immune competence. This isn't abstract, it's concrete immunology. During sexual arousal and, most potently, orgasm, your body generates a significant surge of beneficial biochemicals. Beyond the dopamine and oxytocin associated with well-being, it releases tangible immune-enhancing agents. Immunoglobulin A, IgA, a crucial antibody serving as the body's first line of defense in mucosal linings, respiratory tract, digestive system, genitourinary tract, experiences a measurable spike. This antibody is vital for neutralizing viruses and bacteria before they establish infection. Concurrently, the release of endorphins helps modulate systemic inflammation, a key factor in numerous chronic diseases and impaired healing. Now, envision depriving your body of this potent, natural immunological boost, not briefly, but consistently over months or years. Your system forfeits one of its most accessible, innate defense mechanisms. At a stage in life when immune function is already undergoing a natural, age-related decline, immunosenescence, eliminating the supplementary support is akin to disabling your body's internal alarm system. You might not notice immediately, but when pathogens invade, your defenses respond sluggishly and less effectively. I've observed this pattern repeatedly. Patients who have ceased intimate self-care frequently report increased susceptibility to common infections, prolonged recovery times, and exacerbations of chronic inflammatory conditions like arthritis. While they rarely connect these issues to their intimate habits, their bodies are broadcasting a clear distress signal. A vital component of their natural defense arsenal is missing. Crucially, robust immune function transcends merely warding off seasonal colds. It is intrinsically linked to long-term disease surveillance, identifying and eliminating cancerous cells early, protecting cardiovascular health by reducing inflammation in blood vessels, and ensuring efficient tissue repair and wound healing. Regular sexual release contributes to maintaining a healthier hormonal milieu, reducing damaging stress hormones like cortisol, and enhancing overall circulation, all critical factors for sustaining immune vigilance. When this natural release disappears, a domino effect ensues. Stress accumulates, sleep quality deteriorates, chronic inflammation escalates, and the body's resilience progressively weakens. One woman in her 70s, after losing her husband, confided she hadn't engaged in self-touch for nearly 5 years. After discussing the compelling link between sexual activity and immune strength, she decided to tentatively reintroduce it as an act of self-care, prioritizing wellness over desire. Months later, she returned with noticeably brighter eyes and renewed energy. "I can't fully explain it," she shared, "but I feel more alive, like my body is cooperating with me again, not constantly working against me." This isn't mystical. It's the physiological consequence of providing the body with the signals it requires to maintain vitality and defense. Signals that affirm, we are still active. We intend to thrive. It's easy to dismiss, rationalize away, or feel societal awkwardness about. However, your immune system operates beyond the realm of shame or social convention. It responds solely to biological imperatives and actions. Sexual stimulation, even solitary, is a profoundly beneficial biological action. It transmits a potent message of vitality and resilience through every cell, fortifying your internal defenses against the inevitable challenges of aging and environment. While compromised immunity exposes the body to external threats, the ultimate consequence of neglecting self-intimacy might inflict the deepest wound of all, to your fundamental sense of identity. When you cease touching your own body with intention and care, you risk slowly ceasing to recognize the person residing within it. Let's examine how self-neglect can insidiously corrode your sense of body ownership and intrinsic self-worth. The loss of body ownership and erosion of self-worth is perhaps the most profound and personal consequence. I will never forget a quiet, poignant conversation with a retired school principal in his late 70s. Once a figure of undeniable confidence and sharp intellect, a man who naturally commanded attention, he arrived for a routine checkup with a perceptibly altered demeanor, shoulders slightly slumped, eyes lacking their former spark. As we spoke, he sighed deeply and confessed, "I don't truly feel like I inhabit this body anymore. It feels more like I'm just occupying it, waiting. That sentiment haunts me because its essence is tragically common. I've heard variations from countless men and women, a gradual sense of becoming estranged from their own physical selves. Too often, this disconnection germinates in silence, in the conscious decision to abandon self-intimacy, rationalized as unnecessary, irrelevant to later life, or something they've simply outgrown. Yet, the psychological and physiological reality is starkly different. When you stop touching your body with intimate awareness, when you cease engaging with it in a way that acknowledges its sensations and needs, you initiate a subtle but powerful process of dissociation. Self-touch, even gentle, non-goal-oriented exploration, is not merely about seeking pleasure. It is a profound act of presence. It anchors you firmly within your physical being. When you consciously stimulate your body, you send potent signals through your nervous system. I am here. This body matters. It is still an integral, valued part of who I am, not merely a decaying vessel I endure. Without this reaffirming connection, a psychological chasm begins to form. It becomes easier to disregard minor aches and pains, to avoid mirrors reflecting the aging process, to internalize the harmful belief that this phase of life isn't worthy of nurturing attention or sensual engagement. This is the most perilous loss, the erosion of your inherent sense of worthiness. I've witnessed this disconnection manifest as profound emotional numbness, corrosive shame about the natural aging body, an aversion to physical affection from others, hugs, touch, and a devastating loss of motivation for fundamental self-care practices, exercise, nutritious eating, dressing with care. The underlying thought becomes, why bother investing effort when this body no longer feels authentically mine? One woman shared painfully, I stopped touching myself entirely after menopause. I just stopped feeling like a woman. And the less I touched myself, the more invisible I became to myself. The word invisible resonates powerfully because it captures the essence of what transpires for many older adults who disengage from their physical selves. They don't merely forfeit sexual pleasure, they relinquish a core component of their identity, their sense of visibility, their feeling of being vibrantly alive within their own skin. Here is the vital message I need you to internalize. This estrangement is not inevitable. Reclaiming your body through mindful self-touch isn't about replicating the sexuality of your 20s. It's a profound act of honoring the life force that still resides within you. It's a declaration. I am still present. I am still capable of feeling. I still deserve to be witnessed, acknowledged, and valued, especially by myself. When you courageously rebuild this connection, even within the sanctuary of your privacy, you begin reversing that silent erasure. You remind yourself that aging is not synonymous with vanishing, that your worth did not expire with your youth. You perform the most fundamental act of healing. You come home to yourself. You reclaim ownership of your being. Having traversed these 7 interconnected consequences, the larger, urgent narrative comes into stark focus. While each consequence, from prostate stagnation and cognitive fog to depression, sleep deprivation, pelvic floor weakness, immune compromise, and identity loss, is significant alone, their combined force paints a picture of preventable decline. In closing, I want to underscore what's truly at stake and illuminate the path to reclaiming control, starting today. Reclaiming intimacy is synonymous with reclaiming holistic health. Reflecting on decades spent caring for aging individuals, what strikes me most profoundly are not just the diagnosed medical conditions, but the silent, invisible burdens they carry, burdens absent from lab reports or imaging studies. The man who once radiated confidence now avoids his reflection. The woman who embodied joy confesses she hasn't felt a spark of sensation in her body for years. Repeatedly, they've been told, explicitly or implicitly, that this desolation is simply part of getting older. I reject that notion utterly. And if you've journeyed with me this far, I suspect you do too. The undeniable truth is this. The moment you cease caring for your sexual self, the moment you abandon that dimension of your physicality and identity, a chain reaction of quiet, destructive consequences is set irrevocably in motion. We've meticulously examined them, How prostate and urinary health deteriorate without regular release. How the brain's acuity dims when starved of neurochemical stimulation. How the void of physical intimacy invites depression and emotional numbness. How deep, restorative sleep becomes elusive. How pelvic floor muscles atrophy and circulation wanes. How immune defenses weaken. And, perhaps most painfully, how relinquishing that private connection with your own body erodes your fundamental sense of self-worth and belonging. These are not trivial side effects of aging. They are physiological and psychological warning flares, signaling that your body, mind, and spirit are pleading for your conscious attention and care. I have sat across from patients feeling fractured, adrift, and numb. I have also witnessed the transformative light return to their eyes when they rediscover this vital aspect of self-connection. It demands no partner, no youthful physique, no perfect health. It requires only one thing: your own permission to see yourself as inherently worthy of intimacy, of sensation, of care, right now, exactly as you are, especially now. I understand the societal discomfort surrounding this topic. Embarrassment, cultural taboos, or simply a lack of education about the lifelong importance of sexual health often create barriers. But hear this from a physician who has navigated this intimate terrain with thousands. Engaging in self-intimacy is not only acceptable, it is physiologically essential for holistic well-being in later life. Masturbation for the aging individual is not about indulgence or recapturing lost youth. It's a critical act of physiological maintenance. It's about sustaining healthy circulation, preserving mental clarity, balancing crucial hormones, grounding emotional turbulence, fortifying immune defenses, and fiercely maintaining a connection to your core identity. It is not a frivolous luxury. It is a profound form of self-care, a vital declaration that you remain vibrantly alive within this body and bear responsibility for its continued vitality. One patient articulated it perfectly. I hadn't realized how profoundly I missed feeling like myself until I finally, gently, touched that part of me again. This encapsulates the essence. It transcends mere survival. It's about inhabiting your years with palpable presence, unwavering dignity, and accessible joy. Therefore, if you've forgotten this aspect of yourself, buried it under layers of neglect or judgment, I extend a compassionate invitation. Reconsider. Reconnect. Remember that your body remains receptive, capable, and profoundly deserving of your attention. Begin modestly, with simple curiosity and kindness towards yourself. But above all, begin. Because in choosing to nurture this fundamental part of yourself once more, you are doing far more than safeguarding your health. You are actively reclaiming the fullness of your life, your identity, and your inherent right to feel vibrantly alive in every chapter of your existence.